And welcome to the Dr. Bob Show. What's the leading cause of death in the United States? It's cardiovascular disease. You got it right. But what do we mean when we say cardiovascular disease? Do we mean heart attacks, or do we mean heart attacks and strokes, or other illnesses added? We'll be spending most of this show talking about cardiovascular disease. My guest is Dr. Dan Ely. He's on the faculty of the University of Tennessee and is a board-certified internist. He'll be answering our questions. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about some other causes of chest pain and what's an eosinophil? Sounds like a medical name, but it's getting more and more important. Is it important to you? You'll want to stay tuned. A lot of information. We're talking with Dr. Dan Ely, board-certified internal medicine specialist, associate professor on the faculty of the University of Tennessee. Dan, welcome to the Dr. Bob Show.
Bob, thanks so much for having me.
When we use the word cardiovascular, what do we mean by that?
Well, you're really talking simply about diseases of the heart and the blood vessels and how they interact.
Including other parts of the body than the heart, the brain?
Absolutely. You've got blood vessels everywhere. Brain, kidneys, legs, gut.
So leading cause of death, it could be some of those other areas of the body.
Absolutely.
Is there a common denominator of what's going on in those blood vessels?
Well, when you're talking about diseases of the peripheral vascular system or the vascular system, you're probably talking about atherosclerosis.
That's a big old long word, atherosclerosis. What does that mean in lay terms?
It's a toughie, but it means basically when you get fatty deposits and buildup and scarring within the vessels that causes them to block or stenose.
Hardening of the arteries?
Hardening of the arteries
is a good word for it. So the vessel, what would a normal blood vessel be like? Is it real pliable? Is it?
You would hope so, and when we're young it is, for sure. There's muscle in there and it's distensible, it's elastic, and that's good because it absorbs pressure and stresses and strain. But when we get older, it gets harder, it gets thicker, less able to function in the way it's supposed to.
And that's hardening of the arteries. Is that predominantly cholesterol that's deposited in those areas, or are we just getting older vessels?
It's really both, and we think of it as predominantly cholesterol that causes plaque or buildup in there, but it's more than that that happens in there. The muscle in there gets fibrosed or scarred, and then you get inflammatory products that come in there and cause the muscle to not function well, and then you get this cholesterol plaque that can be the final product that causes buildup.
So sometimes it's hard as we get older when we get hardening of the arteries, atherosclerosis. Are there risk factors for that? If I wanted to know, how can I keep from getting that? Are there risk factors?
Sure there are. And some of the risk factors we can't do anything about. We hope we get older, and that's a risk factor as we age. And your sex has something to do with it. Men have more blood vessel disease, at least at younger ages, than women do. And part of the risk has to do with your family history. And you can't choose your parents, and they've given you a set of genetic factors that will influence your risk.
So then what are the risk factors that we can prevent?
Okay, so that's a very good question, because that's really what we need to be focusing on. And blood pressure, blood sugar or diabetes, and cholesterol and other lipid levels, those are the primary things. And then there's some other things like weight and fitness in general, maybe stress.
Cigarette smoking?
Cigarette smoking, of course, a biggie.
It seems like every time we turn around, we say, stop smoking, because it does something wrong to every part of the body.
Absolutely.
You mentioned high blood pressure. Let's talk about that. What is a normal number? People don't know what their blood pressure should be.
Yeah, and that's a very good question. And it does depend a little bit on your situation. The older you are, the more permissive we may allow a blood pressure to be. And the more other factors you have, the more important good blood pressure control may be. But roughly speaking, we would say 140, or excuse me, less than 140, which is the systolic or upper number, less than 90, which is the diastolic or lower number. Those are normal pressures, so to speak. Above that, definitely abnormal.
So if I came to the doctor one time and I was scared to death and my blood pressure was over 140, the systolic, the high number, let's just say it was 150, and I said, well, it's just because I'm scared, you got a white coat. Is that valid or not?
Perhaps, and we never should do something based on just one simple blood pressure. We always want to take multiple readings, because what's important is what the average blood pressure seems to be day in and day out.
So you have people get their own blood pressure cuff at home?
I think that's a great idea.
You know,
Absolutely.
the people that measure their own blood pressure and take it to the doctor where they know what they recorded, it must be a big help when they do that.
It really is, and studies show that the blood pressures that you record outside of the office, as long as we think they're recorded appropriately with a good machine, are more important than the ones that we get in the office.
I've talked with some of the drugstores, and there's one called an Omron IntelliSense that I've always used at home to check my blood pressure to make sure that it was okay. Is there any other, or are they all pretty good?
I think for the most part, I mean, Omron is certainly a leader and a good quality machine for sure. But I think you can get one at Walgreens that'll do much the same job. You do not want one that goes on your wrist, though. Definitely don't want one that goes on your finger, because those just aren't going to give us accurate enough readings.
And the one you put on your arm, they're digital. You just push a button and it does everything for you.
They're easy to use.
Yeah.
Very much.
So 140 over 90, if it's higher than 140 or if it's higher than 90. Let's go to cholesterol, because such an important thing. We hear so much about it, and we hear all the numbers and the different kinds. It's very confusing to people. So how do you guide your patients on cholesterol?
Okay, so when you come into the office and we're talking about that and measuring cholesterol, we're going to do a lipid panel. That includes...
Lipid panel means what?
Lipid panel. Lipids are blood fats, you might say. And it includes cholesterol, total cholesterol. The number there you're looking for is lower the better, but 200 is considered the upper limit of normal, most labs. You're looking at triglycerides, another blood fat with a different composition. Lower the better. 150 is considered upper limit of normal in most labs. And then you're looking at what's called the HDL, which is the high density lipoprotein.
That's a type of cholesterol or triglyceride?
It's a type of cholesterol is part of the lipoprotein system, and HDL is the good fraction, LDL is the bad fraction.
So we want more of the good?
You want more of the good, less of the bad. And those numbers vary in terms of goal based on other factors, for example. But the lower your LDL, the better. The higher your HDL, the better.
What's the best way to get the LDL low and the HDL high? Are there medicines that do that, or exercise, or diet, or what? How do you guide your patients?
All of that is the best way. There are lifestyle things that you can do, which includes regular physical activity. Exercise is very good for your blood lipids. Keeping your weight where it's appropriate, keeping your weight where you want it, that's very appropriate. And then, of course, a diet that is relatively low in fats, especially saturated fats, will help lower your cholesterol. Moderating sugars and starches in the diet, such as bread and pasta and potatoes, that will help lower triglycerides. So you may have to look at both of those things depending on what your panel shows.
If somebody uses diet, exercise, the right kind of foods, and their cholesterol still is abnormal, are there good medicines, and what are those, and how do you take them? Absolutely.
There's a variety of medicines that are used. By far, the workhorse drugs are the statin drugs, which most everybody's going to have heard of. Lipitor and Zocor. Generically, that's atorvastatin and simvastatin, and there's a variety of others. Those are the ones with the best data showing reduced risk of heart attack and stroke when we use them.
So are they good medicines? They have any, the worst side effect of those medicines would be what?
The worst side effect would be what's called rhabdomyolysis, which is a breakdown of muscle cells that causes kidney failure. very, very unlikely, very rare.
That was a big word, rhabdomyolysis, but
Yes.
that protein clogs up the kidneys in
Yes.
late term, and is that what it does?
It is what it does. However, it does it very rarely. I've never seen it in practice in my patients. Much more commonly, though, you see muscle achiness, what we call myalgias or myopathy. And that's just a nuisance kind of thing that sometimes people can just live with. Sometimes we improve that by moderating the dose of the medicine. And then sometimes people feel like they can't continue to take the medicine because of that.
When you go see your doctor and he tells you that your blood pressure is elevated, does that scare you? Does that make your blood pressure go up a little bit higher? Let me tell you what you can do and what you should do if you have an abnormal blood pressure recording. Simply go to the drugstore and get a self-monitor. This is a blood pressure cuff that you can measure your blood pressures at home. It's digital, so you simply place the blood pressure cuff on your arm, push the start button, and it will record your blood pressure for you. What will that do for your doctor? Well, you can do it in the morning, you can do it at nighttime, you can do it when you're not exercising or after you've exercised, but be sure when you measure your blood pressure that you record it on a piece of paper and you take it to your doctor so your doctor will know what your blood pressure is like when you're at home. It will make a great conversation piece. But now let me tell you about how to take your home blood pressure cuff. Number one, you need to be sitting in a chair. Both feet should be on the floor. Your arm should be at the height of your heart. So if the table is lower, raise it up on a box right there and then record your blood pressure. So the first thing that you have to do is you have to take the blood pressure cuff and you have to put it on your arm. There will be instructions on where you place this on your arm. On this one, we go above the elbow and then we tighten the band. Now, the recorder is on a box. My arm is at my heart level. And now all I do is push the button and it does all the work for me. And now let's see what my recording is. Let's look here. 119/84, that's a good blood pressure. That will help my doctor know how to treat my blood pressure problem. We're talking with Dr. Dan Ely, board certified internal medicine specialist, associate professor at the University of Tennessee, and we've been talking about risk factors of cardiovascular disease. That's not just the heart, that's heart, brain, anywhere you've got blood vessels, so that's all the way down to the toes. We've talked about high blood pressure. You don't want the upper number to be over 140. You don't want the lower number to be over 90. We talked about cholesterol. You have to talk those values over with your doctor, but you want more of the good cholesterol and less of the bad cholesterol. Sounds logical, doesn't it? And don't forget triglycerides. Dan, there's a new guidelines for cholesterol that doctors are evaluating. Can you summarize that for me?
Well, sure. We've been using guidelines for a good while, but in the past year, new guidelines have been developed which take a little more into account and include things like your total cholesterol, your HDL, which is your good cholesterol, your blood pressure, your age, of course, your gender, and they will help calculate your overall risk for having a cardiovascular event, principally a heart attack or stroke, over the next 10 years. And you and your doctor can look at those and help to decide whether therapies beyond lifestyle, meaning the things we talked about, fitness and not smoking, therapies including medicine might be appropriate for you.
You know, you and I were talking, and you're thin, you're in good shape, you're relatively young, you're great. And yet, when you look at these new factors, you're on almost where somebody says you should be on Lipitor. I bet you if I go through those, they're going to throw it at me right away. However, my father, when we're talking about family history, had atherosclerosis, so 20 years ago. when my cholesterol was borderline, normal but borderline, I started on Lipitor, so I've been on it for the last 20 years, and I think that I've got a pretty good vascular system. Let's talk about risk factors, and let's go to obesity and diabetes. Is there a connection between the two? Can we pull them to, or is obesity a risk factor by itself?
I think the two go together a lot. Not every obese person is diabetic, but if you look at the rates of diabetes, they've gone up dramatically in the last few decades, same as obesity. Clearly, obesity is a huge risk factor for diabetes. Diabetes is a huge risk factor for cardiovascular disease.
So we've got to teach people how not to be overweight, or teach people that if they've got borderline blood sugar to be careful. So talk to me about obesity. What do you tell a patient if they're overweight and their blood pressure is high and their cholesterol is high and they're not active? How do you guide that person?
Well, we have a lot of overweight and obesity in our society. We know that. But the good news is you don't have to get down to some idealized weight to modify a lot of potentially detrimental disease processes. Losing some weight will help with your blood pressure. It'll definitely help your blood sugar. It will help joints, and it'll help you orthopedically, help you to sleep better, feel better, more fit. Just a lot of great things come out of losing weight.
If somebody's overweight and getting older, what type of exercise can they do?
Well, here's what I tell people. Any exercise is good.
Try it.
More is better. So what you can do and what you like and what you'll stick with, that's good. And that might be walking, it might be cycling, it might be using an elliptical machine or an aortic track. For people who are older and have orthopedic issues, bad knees, for example, those are hard. Those are not always easy. So swimming and water aerobics are excellent.
It's just a great thing. The water aerobics is so good, and people that do it tell me that they really can have an aerobic activity.
It's a wonderful cardiovascular workout with little to no stress on the joints.
So we work on the obesity with exercise and eating properly. How about diabetes? What's the numbers that we look for? What's an A1c? And I've got so much information I want to ask you.
Sure. Well, a normal blood sugar fasting is essentially 100. A diabetic blood sugar fasting is above 125. So you can see that's not a great difference there. And in between, somebody is pre-diabetic, you might say.
What does pre-diabetic mean? Is that dangerous?
Pre-diabetic is absolutely dangerous. We know that the problems that diabetes causes and exacerbates all occur during that pre-diabetic stage. So hearing you're pre-diabetic doesn't mean you've got to pass until you're diabetic. It means you need to start working on things now.
So it's a warning sign to
Exactly.
wake up and start improving your health if you have pre-diabetes. That'd be between 100 and 126. Tell me about an A1c. What does that mean?
So hemoglobin A1c is a long-term measurement of what blood sugar averages over time. Normal would be 5.7 or less. Diabetes would be 6.5 or above. And in between is that pre-diabetic impaired fasting glucose range. It means it's not normal and you need to work on it.
A lot of numbers, and what I tell people, your doctor knows those numbers, so get your blood sugar evaluated and your doctor will guide you toward health. Tell me about how bad is smoking?
We know smoking is a huge risk factor for cardiovascular disease, a show in itself, I'm sure, for you. And it's definitely something that there is always benefit to quitting. It's never too late to quitting smoking.
So in general, the risk factors that we've talked about is simply what I call 7th grade health. It means exercise, eat right, enjoy yourself. Stress come in there?
Stress is an interesting thing, but it definitely has a role in cardiovascular health. Stress raises blood pressure, for example, may by itself do bad things in the blood vessels. And so stress modification is a good part of general health and cardiovascular health.
I'm going to throw one in just very quickly. It's very, very, very vogue right now. Obstructive sleep apnea, does that have anything to do with your health?
Yes, and sleep apnea is a common thing, and that's when That's when there's obstruction to adequate breathing, the body doesn't get enough oxygen, can be more notable at night when people gasp and quit breathing. There's better treatments all the time that help ensure more regular breathing and adequate oxygenation, and that again takes stress off of the blood vessels in the heart, which doesn't have to work so hard.
Does this obstructive sleep apnea, if people have it, does it hurt their heart?
It is a strain on the heart. The heart has to work harder. So yeah, it does more work and it's going to wear out more quickly.
Dan Ely, I feel really, really good about people understanding that it's good to see your internal medicine specialist, your family doctor, get on a good health program, get active, get all of your risk factors under control, and listen to your body. Your doctor will be able to work on other things, just in risk factors. You're a great teacher. Thank you for taking your time to come to the Dr. Bob Show.
Bob, thanks so much. Appreciate it.
You and I have got a lot of work to do to stay healthy, and it's an everyday thing. So remember, work that out with your doctor. Everybody has the risk factors. If yours are abnormal, we need to work on them. And now we've got to talk about two other things that are on in just a minute, including causes of chest pain other than heart attack, and also an eosinophil. That's a medical word. May be important to you. We'll talk about it. I want to thank Dr. Dan Ely for a wonderful discussion on cardiovascular risk factors. Now, question from you, the viewer, that I think will be important to your health. Question number one, Dr. Bob, what are some causes of chest pain? Excellent question. Most people know that heart pain, heart attack pain, need to know that, is crushing chest pain right in the middle of the chest that stays. It can radiate into the arm, but it may not. It may radiate up into the neck. Usually occurs with perspiration. We call it diaphoresis. Usually you know something's going on, but women may just have vague symptoms that I don't feel good, I feel short of breath. So if you think you're having prolonged chest discomfort, be sure and see your doctor. If you're getting crushing chest pain, 911, chew an aspirin. Other types of chest pain, number one, would be a blood clot to the lungs, pulmonary embolus. It's usually over on the side. It hurts to take a deep breath. You might even cough up some blood. It causes inflammation where that blood clot went. A dissecting aortic aneurysm. The blood comes out of the heart into the aorta. If that aorta has hardening of the arteries and the middle of the artery begins to split, then blood will dissect through that. People describe it as a tearing pain in the chest. If you get that, 911, you haven't got long to get to the emergency room for that. Other types of chest pain, it may be inflammation of the chest wall. We call that Tsetse syndrome. The ribs that come in toward the middle of the chest, the sternum, cartilage is there. Where the ribs and cartilage, if that becomes inflamed, we call it costochondritis. That means inflammation there of where that area is. Take a deep breath and it hurts the chest and the chest is tender and you may think you have a heart attack and your doctor will be able to pick that up. Listen to your body. If you have chest pain, it will tell you 99 times out of 100 if it's serious. See your doctor, talk to him about it. Question number two. Dr. Bob, what is an eosinophil? Now that's a hard question for the Dr. Bob Show because the eosinophil is sort of a medical term. Swimming around in our bloodstream are some cells. One of those is an eosinophil. It's a white blood cell. When we look at it under the microscope, there's a bunch of little round globules in that cell that stain with eosin. They're usually a marker of allergic disease. So if we see eosinophils, we think allergy. But it's becoming very important in people that have reflux. So if you've got heartburn on a full stomach, if you've got reflux, if the reflux comes up and irritates the throat, if it makes you feel poorly, then when you have your doctor look down the throat, he'll get a biopsy. he may tell you have a lot of eosinophils in the esophagus. I want you to start learning that word. Eosinophil, we'll talk about it more on the Dr. Bob Show. That's all the time that we have for this show. Remember those 4 things. We've got to be exercising. Boy, Dr. Dan Ely sure talked about the importance of regular exercise. It can be any kind of exercise you want. It will reduce stress. It will lower your blood pressure. It will lower your weight. It will lower your bad cholesterol. Get 8 hours of sleep. If you're having trouble sleeping, there are 100 different entities that cause difficulty sleeping. So if you've got difficulty sleeping, talk it over with your doctor. You need 8 hours of sleep to feel good. Eat properly, fruits and vegetables, stay away from the fatty foods. You know, it's amazing when you do that how healthy you're going to be. And most of all, what is it we like in the Dr. Bob Show? It's laughter in your life. Find that friend that you love to talk with. Tell stories, begin to giggle. I love to hear my wife giggle when she's talking with her mother about stories in childhood. Giggling makes people feel good. You'll stay healthier. You'll stay happy. So giggle a lot. It'll be good for you.